The Smart Plug from Medenium, a flexible thermodynamic hydrophobic acrylic punctum plug designed to fit and stay in the punctum as an innovative treatment for dry eye, ultimately allowing for an increase in tear film retention while providing maximum patient comfort. This video presentation will demonstrate the proper technique of handling the Smart Plug. By following these uncomplicated steps, you will help ensure a repeatable, smooth Smart Plug insertion process. The Smart Plug comes packaged 2 plugs per box, with each plug contained in an innovative carrier. To expose and then remove the Smart Plug from the carrier, first grasp the carrier with the thumb and forefinger and squeeze the carrier base. This action will expose the top wing of the carrier. Next, grasp the top wing of the carrier with the other hand and twist back the first 3 to 6 millimeters. Once this action has been accomplished, release the carrier base and continue to peel back the top wing until it is completely separated from the carrier base. This will expose the carrier channel. Now grasp and squeeze the carrier base again. This action will expose the Smart Plug in the carrier base channel. The Smart Plug is now ready to be grasped with forceps. We recommend using the Smart Plug forceps, model 502 from Medenium. These forceps have been designed with a single groove that fits around the Smart Plug. Using these forceps, align the grooved end of the forceps with the Smart Plug. Once the alignment is ensured, gently squeeze the forceps and carefully lift the Smart Plug from the carrier. Be careful not to exert excessive forceps pressure on the Smart Plug, as this could result in damaging it. Should the groove not be aligned with the Smart Plug, or the forceps slip off the Smart Plug during the removal process, simply grasp it again with the proper alignment and proceed with the removal. Once the Smart Plug has been successfully removed from the carrier, it is ready for implantation. If the medical history of the patient reveals prior use of plugs or surgical closure, it is recommended to check for punctopatency to verify the absence of obstruction. Once this is done, the Smart Plug is grasped with groove forceps and the patient's lower lid is depressed to expose the lower punctum. And at least 2/3 of the Smart Plug is directly inserted into the lower punctal opening, leaving 1/3 of it external. Keeping the patient's lower lid depressed, the Smart Plug can be observed protruding from the punctum. The patient's body heat warms and activates the thermosensitive acrylic material. Changing the Smart Plug from a rigid 9 mm cylindrical rod with a 0.4 mm diameter to a cylindrical soft gel, approximately 2 mm in length and 1 mm in diameter. The thermodynamic action of the Smart Plug, from insertion until it is completely contracted into the vertical portion of the lower canaliculus, takes approximately 30 seconds. However, variations in eyelid temperatures may affect the speed of the solid to gel transition of the Smart Plug. An alternative insertion method would be to introduce Smart Plug into the punctum vertically, then nasally. In this slow motion view, the patient's lower eyelid is rolled down, exposing the punctum. Smart Plug is introduced into the punctum about 2 mm. Once this is done, it is regripped and redirected into the canaliculus in a nasal position by rotating it 90 degrees. Smart Plug can now be advanced directly into the canaliculus nasally, and no more than 2 mm of the plug should be exposed. Due to its thermodynamic properties, any portion of the exposed plug will then gently retract into the vertical punctum. It is important to ensure that during the insertion, patient blinking does not displace Smart Plug from the punctum. If displacement occurs, simply advance the plug back into the punctum. In this insertion, Smart Plug can easily be inserted into the upper punctum using the same techniques. The Smart Plug has been developed to accommodate to the natural size of the punctum, providing complete occlusion. If necessary, however, the Smart Plug can be easily removed by irrigating it out. It is important to note that if the ambient room temperature where the Smart Plug package is being opened is greater than 30 degrees centigrade, the Smart Plug package should then be refrigerated 30 minutes prior to being opened. This will help to facilitate removal from the carrier, as well as prevent its thermodynamic activation until it is placed in the punctum. Remember these tips. Check the medical history of the patient for prior plug use or surgical closure of the puncta. Follow the precise steps in opening and removing the smart plug from the carrier. Release the carrier base from its squeezed position before peeling back and completely removing the top wing. Ensure alignment of the grooves in the forceps to the end of the smart plug. Do not exert excessive forceps pressure on the smart plug. And if the ambient room temperature where the smart plug package is being opened is greater than 30 degrees centigrade, the smart plug package should then be refrigerated 30 minutes prior to being opened. This concludes the smart plug handling technique presentation. These easy-to-follow guidelines will help ensure a successful implantation time after time. The Smart Plug Flexible Thermodynamic Hydrophobic Acrylic Punctum Plug from Medenium, providing ophthalmic patients with a new way of seeing.